participating in the Wellness Wave brought to you by ACP Southern California Region 3. My name is Isha Lal, and I'm a medical student at UC San Diego, and today I'm honored to be interviewing Dr. Mehdi. Dr. Mehdi, can you tell us a little bit about yourself and your journey in medicine?
Hi, how are you? So, I'm a medicine doctor who currently also doing or actually finishing my Master of Public Health at UCSD. So we kind of connect me
Mm-hmm.
and you, the same school. And Also, I'm a mom of two kids, age 3 and 4. Um, Currently doing and practicing at Scripps Health at Chula Vista, and currently we're helping with the ACP wellness and burnout. So
Wonderful.
yeah,
We're
good.
so happy to have you. Can you tell us a little bit about how you chose the career path that you took and your specialty?
So I'm originally from Iraq. I came here to the United States. I had to do my USMLEs,
Mm.
and as an IMG, your options kind of limited. So, but I love medicine in general, like internal medicine. I love to know about everything. I'm a kind of person who, whenever you have a gathering, I like to give some comments and be like, this is how you do things. This is right. This is wrong. I like to give some advice about medicine. So internal medicine was kind of the best choice for me. So I kind of know about most of the thing, and I can talk about most of the stuff. And initially, I wanted to specialize in hematology oncology, but then
Mhm.
um, I had some like a tragic family member death because of that, and then I just chose that path was not for me, and
Mhm.
I wanted to be more in public health, and that's why I'm doing my master of public health. I want to be more helping like larger number of patient and helping the community.
Wonderful. Thank you for sharing that. Our
Mhm.
next question for you is, do you have any
Mhm.
advice for rising medical students and current residents on how to navigate choosing their own career path?
So they always, always say, do what you like, do what you feel you're compassionate about. Um, Many people, like, they have a good scores, they do well in their medical school. They think, well, I have, I should choose like, you know, ophthalmology or dermatology, or because I'm a good medical student. But in reality, you have to do what you really like. What you think you're gonna excel at. So uh, I what I think it's best is during your medical school years, try to see which rotation really is you're passionate about. You're connected with patient more about. So when I did my medical school, I used to like the hematology oncology rotation. I felt like I'm good in telling, bad news, and I know how to approach patient and emotionally, and don't let them, feel down about their diagnosis. So that's why it was one of the choices that I wanted to do initially. So I would say during your rotation, try to find something that you will love. So your medical school is probably your best bet to find your career path, or which specialty you want to do.
Perfect. That's really great advice. So now
Thank
we're
you.
going to transition into the more wellness portion of the interview. So we have a couple of wellness questions for you. The
Hmm.
first one is, do you have any advice for medical students and residents on how to combat burnout?
Well, burnout. We've been like 2 years dealing with the pandemic now, and as a physician in SoCal slash San Diego, we were really struck by the pandemic and the COVID cases, especially down in Chula Vista and San Diego. It was really a tough time. But I started like a spiritual journey a few years ago, and it really helped me in that thing. Because every time you get to a point where you're about to you feel like you cannot do anything. You see people dying and young people dying. You have to tell families your loved one is dying. So you have to remember that these people are human. They're going to be have they will have emotions. You have to deal with it, and then help yourself, because whenever this emotion comes from people, you just try to take it and then try to be present at that moment. Remember, they are human, you're human. Whatever thing they are going through, you one day it will be your turn, and maybe you'll have that hard moment later in your life. So try to be very gentle with them, and then with yourself. Try to meditate, try to work out is one of the like few things that really helped me in getting out of the burnout. It's not something that I used it as a punishment to myself because I ate too much, but I try to use it as a like a gift to myself. So every time I'm stressed, I'm too burnout, I'll go and I do like a run, I do like some workout because it make you feel good. So like few things that really helped me was the to meditate, and meditate can be anything. You can, I don't know, you can pray, you can just sit on a beach, you can, or like in nature in park, and also try to exercise. So that those two things, listen to music, anything you love.
That's beautiful advice. Thank you for sharing that. Our next question for you
Mhm.
is, do you have any advice for medical students on how to remain happy during really intense study periods?
Well, so in life you have only two choices. You either be happy or unhappy. So uh so if you're not gonna be happy, the opposite will happen. So I
Mhm.
always try to tell this to myself. Um I mean, unhappiness is gonna drag you down. You're gonna be upset. You're gonna be anxious. You're not gonna perform well. So try to take the moment as it is now. Try to say, well, it's a period of time. I have my exams. I'll get done with it, and then I'll go back to my regular activity. I'll see family. I'll see friends. So try not, because it's a choice. Happiness is a choice. So you, and how you think about things. You're maybe you can think about it as, well, I'm lucky. I got to do what I love. I'm a medical student now. I chose this path, and I was accepted at the medical school, and now I have the chance to go through those exams and then graduate and be an attending, and be my own um like I'll be like the attending. I'll be my own risk. Like I'll be responsible for myself. So this is one way of thinking about it. So you choose the happiness. Don't let unhappiness drag you down.
Yeah, that's such a great point that we choose our own happiness and we also choose the perspective that we take. And like you mentioned, switching our perspective a little bit can have such a huge impact. So thank you for sharing that. Our last wellness question for you is,
Mhm.
do you have any advice on how to handle perfectionism in medicine?
So perfectionism. So I mean, we all try to be perfect, but we have to remember we're human. We're not gods. So human will make errors. Everyone will make error. Even your favorite attending, your favorite professor, they will make their own mistake. They will admit at some point, well, in my such and such years when I was a medical student, or when I was this, I had this mistake. So it's okay. Your mistake is there, so you can learn from them. And the nice part about like this is that always remember that people try to do their best. So when people try to do their best and be perfect, this is a good example for you, so that when you have your next challenge, you can use that experience for the next challenge. So let's say you have an attending who want every note to be perfect. You use this and try to see like how they are going through their note, what are the things that they are looking for. Maybe you'll adapt this, and then it will be you'll take all these steps and those tips, and then you incorporate it um, in your like way in your life. So like for example, I had an attending in my residency program. She used to have tips on how to write the assessment and plan. And at that point, I didn't like it because she was very specific about things. But then I took that, and then it became one of the things that I always look for in my notes. One of the things that I make sure that it's there. And then when I did do teaching at a faculty in Wayne State University, I did look for these stuff in my students' notes. So it's it's something you can take and use it for your own benefit. And remember, they are all human. There's no one is perfect. So take it day by day.
That's great advice. And yeah, that's such a great point in remembering that our mistakes are opportunities for growth. So thank you. Okay,
Thank you.
well, I just wanted to ask you if there's anything else that you'd like to add for our medical student and resident viewers.
So I mean, one thing that I always say, medicine is stressful because we're dealing with people life. We're not like, someone who's doing the regular job at a, grocery store or something. We're not trying to estimate their roles, but we deal with more of more intense thing, which is people life. So always keep in mind that these people have the same emotion that you have. So they will have the same reaction that you will have if your loved ones is there. So every time I have a difficult situation or a difficult patient, I think of them as they are my family, and then how would I react, and then try to understand that other person perspective. It will help a lot. It will get you through that situation for sure. And you will find a way to convince them of your point, or not even convince them, to explain what's your point in doing this. So this is one thing that I always tell my medical student: try your best to put yourself in other people shoes, and then try to understand why they are reacting that like that. We're human. We have emotions, and then just because you're the physician now, that doesn't mean you have to take your emotion away. Um, and read books. I like books, so try to get more, into psychology, into spiritual. Try to understand life better, so you'll be a better physician.
Wonderful. And do you have a favorite book that you can share with us?
Well, yes, I like the Untethered Soul by Michael Singer, and
Ooh,
then the Power of Now by Eckhart Tolle. So these two books are my favorite. I always recommend them to people who are going through hard time.
wonderful. I'll add those to my reading list as well.
You will love them. I'm pretty sure.
I'm excited. All right.
Okay.
Thank you so much, Dr. Mehdi. It was wonderful getting a chance to talk to you. I know I benefited immensely from this conversation, and I'm sure our medical student viewers will as well. So
Thank you
thank you.
so much. Thank you.